pediatrician at Kidsville Pediatrics, the McKinney location. Today, I'll be talking about how to prevent and treat diaper rash. Diaper rash is one of the most common skin problems in infants and children. There are several types of diaper rashes. One of the commonest type of diaper rash is the irritant diaper rash, and this is usually due to when the skin comes in contact with the stool or urine frequently or for a prolonged period of time. The diaper rash usually, appears as a red rash in the diaper area. It usually starts from the area that has the maximum contact with the irritant. For example, like the perineal area. What do you do to prevent diaper rash? One of the most important ways of preventing diaper rash is by changing the diaper frequently. So try to change the diaper as soon as the diaper is dirty or wet. In the newborn, you might need to change the diaper like every 2 hours or 3 hours, or even sooner if the diaper is dirty. Another way to prevent diaper rash is to keep that area clean and dry. Cleaning the area, you can use warm water or you can use wipes, and pat the area dry. For kids that get diaper rash frequently, we usually recommend to apply a barrier ointment or cream, which can be gotten over the counter. Good brands, for example, the ones that have petroleum jelly or zinc oxide, apply that to the diaper area with every diaper change. When you secure the diaper, try to make sure it's not too tight. This is going to allow some airflow in that area. Also, if you use cloth diapers, try to wash the diaper frequently. Wash it thoroughly in hot water and also in fragrance-free detergents. When your child has diaper rash, the tips to treating the diaper rash would be similar to what you do when you prevent diaper rash. Like I said, the important thing is to change the diaper frequently as often as you can. When the child has a diaper rash, it is preferable to use warm water to wash the area. Try to avoid wipes, but if you must use wipes, use the fragrance-free wipes, or you can use water wipes to just gently clean the area. After patting the area dry, if there is time, try to allow air to flow in that area to air dry the area. And then the very important part of treatment of diaper rash is applying a thick paste or barrier ointment to that area, and then you can put a new diaper on the child. Usually with these measures, the diaper rash should get better in about 2 to 3 days. However, if the rash is not getting better, this would be an indication to see your pediatrician, as the rash might be getting complicated with, for example, getting superimposed infection like a yeast infection or bacterial infection. Yeast diaper rash is another type of diaper rash. Usually, it starts with an irritant diaper rash and then it becomes secondarily infected, and the yeast rash usually appears as bright red rashes that is spread into the thigh and also the inguinal folds. When you see your child has this, then that means that you need to see the doctor. Usually with the yeast infection diaper rash, they would need an antifungal treatment for that. There can also be a bacterial infection of the diaper rash area. So that would appear as pimples or pustules. With that type of diaper rash, usually we would need to prescribe an antibacterial ointment. So if the diaper rash is not getting better, after treating at home for about 2 to 3 days, it means that you need to seek, extra care.